Hi, everybody. This is Dr. Sean Palmer. Thank you for joining me on my talk of Don't Let Sniffles Steal Your Season. And this talk is for you. If you're someone who, maybe you're someone who doesn't want to get knocked out by the various colds and flus going around each year. Or, maybe you're someone for whom if you do get sick, that causes you problems. So that could be like maybe you don't want to miss like certain family events. Maybe you're someone who's going to have a hard time with missing work, especially since if you're an hourly person or someone who's self-employed, sometimes that's a little bit more challenging. Or also if you want to try to see what you can do to help reduce your medical expenses if you're with your family or just even for yourself. And what would it be like if you could uh, not, even though everyone else around you is getting sick, what if you could like prevent yourself from getting sick? And also, like if you were to start to get sick, what if you could kind of stop it and nip it in the bud early, rather than like having to suffer with it through the duration? And so that's something we're gonna talk about with you today. So you don't have to turn into somebody who's feels sick and not well for a good week, 2 weeks out of the year, which a lot of people are kind of going through right now. I know there's a lot of bad colds, flus going through, and part of my job is to try to help you not be one of those people. So in this talk, you're going to learn how to stay ahead of the cold flu season with a few simple strategies. I'm also going to teach you, like, once you start to get sick, what are some things you can start using so it doesn't have to turn into anything more significant. And also along the way, how you can support not just yourself, but also your family and friends. And by doing so, also help me reduce the likelihood of your family needing to go to see the doctor's office. So with that, we're going to get into it. Cold flu prevention. Probably my very first trick is plain old vitamin D. Now, there's a reason that why we call it the cold flu season. And the cold flu season in the winter is because winter is when your vitamin D levels are low. Vitamin D plays a really important role in helping you not get sick. So low vitamin D makes it more likely for you to get sick. Now, you don't really know for sure what your vitamin D levels are without doing some sort of blood test, which is available at Wyoming health fairs. And it's certainly something I'd be happy to talk with you about if you wanted me to review your vitamin D status. But for most of my clients, what I find is around 5,000 IUs tends to, and that's 5,000 IUs a day, tends to put most people about in the middle of the range of the vitamin D blood test. And so that's what most of my clients end up being on. Again, I can't say anything specifics for one individual without a blood test, but vitamin D, like I said, is a really important piece for preventing yourself from getting sick. The other one that I really like is actually green tea. And this is one that doesn't usually get a lot of press. But green tea actually has antiviral benefits. And in fact, there was a study done out of Japan, and there's actually been multiple studies on this with green tea. I just wanted to focus on one particular one. So there's a study out of Japan where they would give Japanese hospital workers green tea extract. And they found when they did that reduced the likelihood of hospital workers getting the flu by 75%. So green tea can be pretty significant in the prevention of colds and flus. And most of the research on green tea has been more on the prevention side. And there's a lot of ways you can apply it. So you don't necessarily have to do a pill. You could also do just green tea, and any green tea or the counter, like at the grocery store, ought to work. Or in some cases, they even had some research studies where they have people rinse their mouth out with green tea. So there are other ways you can apply this. So you got to figure out what is the way that makes the most sense for you, and maybe works best with your lifestyle. If I were to try just drinking green tea, I usually recommend probably 4 to 5 cups a day of green tea for prevention. And if you're going to do a pill, usually it's around 300 to 400 milligrams of a green tea extract. So green tea can also be a really good method for prevention, and a pretty easy and safe one for most medications. And the other big question I always ask is, well, what causes people to get sick? And when it comes to colds and the flu, besides being around someone else who's been sick, there are some things that make your body more vulnerable. One of those things is consuming sugar. Every time you eat sugar, your immune system your immune system decreases in function for 4 hours. And so especially if you're someone who's eating a little sugar throughout the day, so let's say maybe put some sugar in your coffee first thing in the morning, then maybe you like to have a little bit of a sweet midday snack, and then maybe even like a little sweet something after dinner. If you do that during the cold flu season, you could have your immune system not working as well for as much as 12 hours that day. I should also mention it's not just sugar. This also includes refined flours, so anything that's white flour, like so that would be stuff like crackers, white breads, pastas, can also contribute a little bit to this. And white flour for me is not just wheat flour, which is what most white flours out there are, but also like if you're someone who's going gluten-free. A white flour can also include white rice flour or white tapioca flour. In fact, white rice flour and white tapioca flour are probably worse for your blood sugar than just normal white flour. So usually I tell people avoid sugar for sure, but also be mindful of how much other kinds of white flours you're consuming that might spike your blood sugar. And the other one is stress. I've seen a number of examples where people either are under a lot of stress and get sick, or because of stress, they keep getting sick. Meaning that like they get initial illness, and because of the stress, they just are having a hard time getting over it. And so stress is another component. And so some of the tricks with that would be either trying, if you're able to try to change your environment so you're not as stressed around times when the colds and flus are going around, or trying to engage in regular anti-de-stressing activities, or sorry, trying to engage in de-stressing activities. And so that'd be stuff like maybe for some people that'd be yoga, for some people that could be like daily prayer or some sort of meditative activity. For some people that could be just watching a comedy. And if your stress is especially persistent long term, that might be something you may want to have a conversation with a counselor about at some point. In terms of what would be some de-stressing activities that are more specific to you, if that's again a sort of a chronic problem. But not just trying to support your immune system, but also trying to understand why your immune system struggles can be two really big steps also to prevent yourself from getting sick, like colds, flus, and some of this stuff will also apply to other types of things you may experience in the winter, such as sinus infections. And so the first part was how do we prevent from getting sick? And the second part is once you do start to get sick, how do we treat it? Because there's this kind of magic window. It's that first 12 to 24 hours when you feel like you're first starting to come down with something. If you can be really aggressive with some sort of antiviral or antibacterial or immune support herb or product, a lot of times that will keep you from getting worse. And so I've had a number of cases with myself, with family and friends, and even with patients where if they are able to start taking, say, an herb, the instant they start to feel sick, by the next day, they feel fine again. And so if you can hit that magic initial window with something is really where you're going to have the best effect of keeping the bug from kind of getting its teeth into you. So one of my favorite herbs for that is actually Oregon grape. Oregon grape kind of acts like actually a mixture between echinacea and golden seal. So it has both antiviral and antibacterial properties and sort of helps support your immune system. And so this is something that like I usually personally do like in tincture form, but you're not limited to tincture. And this is also a plant like you're not usually is one that you have to kind of do a little bit more digging around for, but the herb house oftentimes will have Oregon grape or have it in maybe as some other added product. And it's also better known for one of its compounds, which is called berberine. So berberine is starting to get a lot of press more for its your ability to help control blood sugar. And in some cases, there's some people are trying to use it to see if it helps them with weight maintenance or weight loss because of the blood sugar benefits you get from Oregon grape. So, but for me, my main use for Oregon grape is usually actually for immune support and helping with getting rid of colds and flus. So this is a trick for when you start to get sick. The way I use it is usually I typically use it in the form of a tincture, which means it's been extracted in some alcohol base. And in tincture form, usually I end up doing about 3 droppers of it 4 times throughout the day until I notice I'm feeling okay again. The other one I also really like is elderberry. Elderberry is a nice one because a lot of herbs don't always have a pleasant taste, and so elderberry actually has a very pleasant taste. It's a sort of a sweet berry flavor. Sometimes you'll find it like more as a syrup, and this one is probably more of an antiviral than an antibacterial. And so elderberry is maybe not appropriate for all kinds of sick circumstances you may run into in the winter. But since most of the winter things that you're going to run into are viruses, elderberry can be effective for most of those. And for those of you who have kids, I know a lot of kids don't necessarily like kind of weird flavors. And so this is one that's usually easier to kind of get kids to consume. Again, most of these that I'm going to prescribe for when you're starting to get sick, you're going to want to be taking it probably 3 to 4 times a day. Sometimes I'll even do 5 times a day. And so usually what I do is I look at whatever is considered a dosage on the bottle, and then I take that dosage at least 4 times that day. For elderberry, a lot of times it's the form of a syrup. That'll probably be about a teaspoon. So you're probably doing 1 to 2 teaspoons 3 to 4 times a day. And then no talk about colds and flus could be complete without talking about vitamin C. A lot of people use vitamin C more as a preventative, and you can certainly do that kind of as if you may do about between 1 to 3,000 milligrams of vitamin C a day. But there are also protocols that are used for using vitamin C to treat colds. Usually those protocols use very high doses of vitamin C, and so that's something you may want to spend a little time looking up is what's called using vitamin C to what's called bowel tolerance. Bowel tolerance basically means you're taking enough vitamin C to the point where you get loose stool. So this is not a trick you're going to want to do when you're traveling, or if you got like you're going to need to be going to work. This is more of a good trick for when you know you're going to be at home for a little while. Typically, what you're going to do is something like maybe like 1,000 milligrams of vitamin C every, say, half hour or so, until you get, or even some people even do every 15 minutes until you get loose stool. And once you get the loose stool point, you stop, and then, or at least you stop for the day. And then the next day, if you need to, you do vitamin C again, but you stop at 1,000 milligrams shy of whatever caused loose stool. And so by doing those high doses of vitamin C, sometimes some people are able to keep some viruses at bay. But like I said, that's a protocol you might want to take a look at through, do a little research online to kind of make sure you're doing that right. Or if you want, you can also contact my office and we can kind of give you some more details on that. And then one of my last favorites is myrrh. And as you kind of see with the little picture, this is the same myrrh as in the nativity story, that had gold, frankincense, and myrrh. And myrrh is actually a resin. And myrrh is a really good antibacterial. So I use this myrrh, I don't use so much as an antiviral, but it kind of covers a lot of my antibacterial things. And the reason why I like that is sometimes I'll do both an antiviral and an antibacterial, just kind of cover my bases, just in case I'm not sure what I've got. And usually, again, with myrrh, I'll do about 3 droppers 3 to 4 times throughout the day for a few days. And this is also one that typically the herb house has. And so with myrrh, what I'll do is I usually go down the herb house to get my myrrh. And when I request at the herb house, sometimes they don't always have it out front. So there are a few of these that if you don't see it from whatever vendor you're choosing, you could ask them in case they do have it, but it's just not necessarily out for display. But myrrh is also not always the greatest tasting herb. So again, this is probably more for adults. And this is something where a lot of times what I'll do is I'll take a couple of these and I'll mix them together. So a lot of times I'll mix my myrrh with, like, say, some Oregon grape, and or like with some other antivirals that I've talked about previously. And by doing that, I'll kind of have a mixture that can cover a whole bunch of different things. But yeah, like I said, myrrh can act as a pretty profound antibacterial for folks when you need that. And so again, all those tricks I talked about were for what you should do when you're first trying to get sick. And so then, the next question is, well, what do you do when you are more, the sickness now has gotten its teeth more into you? And that's usually a little more challenging circumstance. But usually it's about maintaining, trying to still be aggressive with uh, either an antiviral and antibacterial, or kind of a mixture of both at the same time. And because I also have had some instances where even if I do get sick, I can at least kind of limit how long it's going to last. So within about a day or two, I notice I'm feeling better. And then maybe even within 3 or 4 days, I can usually expect that the bug's going to go away. So at least try to minimize either it turning into something more serious, because for some people, when you get sick, they're worried about what's going to turn into a sinus infection, or if it's going to turn into like pneumonia. And so part of this is also just preventing those things from happening, and also preventing it from turning into an illness that you get to experience for the next 2 to 4 weeks. Because sometimes some people will get something and it'll just linger for several weeks before they start to feel better. And so even just being able to, even if the best you're able to do was to limit it to 2 to 3 days, you've done pretty well. All right, so, and then another big trick is making sure you're prepared. The reason why I put that slide in there is because sometimes people don't start searching for answers until they're starting to feel sick. And so this is an area where it's good to be ready. And so already have like 1 or 3 things that you notice that tend to work well for you already at hand at home. So if you're starting to feel a little sick or feeling a little ill, like say in the evening after you got home from work, or maybe in the weekend, or maybe Sunday morning, when like a lot of these shops are not going to be open, or if you're going to have to place an order online, it might take 2 days to a week before you even get it to you. Having it already at home kind of prepares you so you can start doing something, being proactive right then and there, rather than waiting. Because, like I said, the more you can kind of nip in the bud early, the better of a result you're going to get. And then there may be some circumstances where you're really struggling, and those are more times where that sort of is beyond the scope of a talk like this. So there are like some other circumstances that where I probably need to actually talk with somebody and like have more of a visit to see what's happening. Some of those instances where someone either keeps getting sick over and over and over again, or you have a really long lingering bug that's just not going away. Sometimes some of those can come to some of the initial cause things we talked about in the very beginning. So low vitamin D, stress, and/or a poor diet. But there are some other circumstances unrelated to those things. And so again, that would probably end up being beyond the scope of this particular talk. But if you do feel like you're really struggling in this area, I mean, do realize that there are some other things that are available. And I'd be happy to, if you feel like you need to make an appointment for that, I'd be happy to have a visit to kind of go over those with you also. So with that, for probably like 70–80% of the time that you notice you're getting something, these tricks can help you both stay well and keep you well. And I have certainly experienced that, not just with my clients, but these are also tricks I use in my own life. And so with that, like I said, your first step we talked about was working on prevention and having those steps in place. And then your second thing is being prepared to have something at home if you do start to get sick, so you can kind of nip that in the bud early. And if you do those 2 things, I think you'll find the majority of the time you will keep yourself from getting sick and being able to continue living your life the way you'd like to. So you can kind of go to your kids' basketball games, or go enjoy time with friends on the weekends and not have to worry about illnesses as much. So again, if you have anything that comes up with this, you're welcome to give my office a call. In the meantime, I hope all of you have a very good start to your winter season.